When several neighboring teeth are missing, an implant-supported bridge is the optimal treatment option for replacing them. When teeth are lost, the jawbone will begin to resorb or shrink. Over time, the ridge of the jawbone becomes much thinner, and the remaining teeth begin to shift into the open spaces. The adjacent teeth have to overcompensate for the missing teeth, and eventually they too may be lost. An implant-supported bridge is a permanent and non-removable treatment option to replace your missing teeth and to prevent further damage. Although all cases are slightly different, placing an implant-supported bridge generally involves a few steps. For your comfort, the area is numbed and an opening is made in the gums. A series of drills are used to make a space for the dental implant. The dental implants are placed into the prepared openings. Sometimes covers are placed on top of the implants, and the gums are stitched closed for healing. In other cases, a healing cap is attached to each implant, and a temporary bridge is placed over them or attached to the adjacent teeth. Over the next few months, the implant will integrate and become securely fused to the bone. If necessary, the implants are uncovered and an extension is attached. A series of impressions and bite registrations are taken and sent to the dental laboratory. The impressions are used to fabricate a model of your mouth on which the final bridge is made. An implant-supported bridge has several advantages. Unlike a traditional bridge, there's no need to cut or reduce the neighboring teeth. The implants stop the bone loss that occurs when the teeth are lost. The bridge prevents the surrounding teeth from shifting into the open space. Most importantly, an implant-supported bridge is the most natural and functional treatment option. With proper home care and regular checkups with your dentist, your dental implants can last a lifetime.